Hi, everyone. It's a real pleasure to be with you today representing Generation Victoria, or GenV. I'll start with a brief overview to frame GenV, which by 2035 has the vision of helping to solve complex issues facing our children and adults now and in the future. GenV is based in the state of Victoria, which is at the bottom of Australia. And what it is a whole of Victoria cohort targeting all 150,000 babies born between October 2021 and September 23 and their parents. And it has 6 building blocks. Firstly, consent in the days or weeks after birth. Secondly, universal biosamples. Thirdly, linked administrative and services data, both curated and unstructured. Fourth, GenV collected data on a large scale. Fifth, a commitment to integrating collaborative studies within and alongside GenV. And sixth, the design of the platform as a service with the needs of diverse stakeholders in mind from the outset. So when I think about a modern longitudinal study, I can liken it to a piñata filled with opportunities, studies, hypotheses, and challenges, none of which we can really predict at the outset. So GenV has really epitomized this. If we look here at this timeline from January 2020 to 2025, we were due to start recruiting in April of 2020. Instead, we had lockdown, easing. We started our vanguard 8 months later in December of 2020. Lockdown, started our scale up, lockdown. Cohort became statewide in October, and now we are experiencing the economic and social upheavals of the Omicron variant, and who knows what's to come in the future. So this has offered immense challenges, but also incredible natural experiments against a background of GenV participants, preconception, conception, pregnancies, births, and long-term follow-up. So how are we aiming to design GenV for longevity, flexibility, solutions, and impact, given the world in which we find ourselves? Well, firstly, large size and inclusivity, because if everybody is in a very large study, then we have the potential to drill down with adequate power to look at subgroups as needed, even though we don't know what those issues or subgroups will be. Similarly, multidimensionality, measuring all the layers of the exposome, so we can cut and slice with that large size to address the issues of the day. Using what's there, whether it's biosamples, services, staff, because we now know that the first thing to go in a crisis is the bespoke research components of a study. Designing to the needs of your stakeholders, whether that's families, policymakers, or services, so that they need your data and they will advocate for your study to continue. And again, you can actually address their needs as you go forward. Focusing on high throughput, low burden measurement and data to future-proof your study, both against costs and uncertainties. And I would really argue, if like us, you're focusing on children, to also focus on parents in their own right as early midlife adults, not simply conduits to the children, because this is the generation that is about to experience the next wave of non-communicable diseases. And this is the generation on whom the world depends right here, right now, for economic and social productivity. Designing for the problems that matter, we're looking to initiatives such as the global burden of disease to ensure that we can address issues like diet, obesity, global heating, mental health, injury, disability, and that these are right at the forefront. And lastly, designing in the capability to embed interventions. It's been said that it's time to stop describing and start fixing of longitudinal studies. and to do that right from the outset, and on those same lines, to collect the outcomes that matter that will enable interventions to be informative for decision makers to decide on new approaches and whether to implement them. So with those last two in mind, you can see our thinking in a couple of recent papers, one about integrating trials into a whole population cohort, and the other about synthesizing core outcome sets to guide top tiers of measurement in GenV. So thank you very much, and I really look forward to the rest of this discussion and the remaining 2 days of this conference.